All right. Good morning, everybody. We are February the 13th. I've been getting a lot of questions from agents on, hey, what do I do after I do an enrollment? Okay. Is there any follow-up that needs to be done? And is there any campaigns that I need to, make sure that that I have these insureds on? And yes, the answer is there has to be a lot of follow-up, guys. And so you must do some kind of follow-up with your new enrollments. Okay. Um, you got to remember that just because you enrolled them, it doesn't mean that other agents aren't still going to come behind and try to move them to a different plan. It happens. It happened to me yesterday, and I was so mad at my client. I'm like, come on, dude, quit talking to other freaking agents. Stop it. And he's like, oh, I got to get my head screwed. I'm like, yes, you do, because you're causing more damn work for me. And I already got you in the best plan, and they already screwed him once. They moved him to a different plan, and one of his meds wasn't covered. And then he's bitching about getting a $600 bill or a cost for a medication. I'm like, why did you move? Well, they told me I had more dental. Do you need dental? No. Well, then, damn, why did you do it, dumbass? I was so mad. And yesterday, same thing. Oh, I'm talking to this guy. I'm like, anyway. So, bottom line is yes, you have to continue to talk with your clients after enrollment. So, I'm going to share with you guys what I do um, in my initial and then what I do throughout the year. Okay. So, ah, too many wrong screens. Hold on. Get this thing going here. All right. Okay. So first thing, guys, is you got to play, or you got to work harder or work smarter and not harder, or do both. But anyway, you still want to do it smarter. And there's no way with a sizable book of business for you to do it all. Something is going to give. You are either going to keep selling and your book on the back end is going to go backwards, or you're going to sell, or you're going to work on your book, but you're not going to sell as much. And a lot of agents do not like to spend money and hire people. It's like you guys are so afraid, or maybe a little tight on the money, and you don't want to invest on a staff person. And I will tell you, the bigger, better, stronger, larger agents have staff. Okay. And, it takes a little bit of investment on the front end, but if they're good, then they really do not cost you money. They save you money. They make you money. All right. But anyway, let's talk about what I do. So let's just take an initial enrollment. Okay. So we have an initial enrollment, and what I have created for everybody is these initial enrollment workflows, but they're very specific to every carrier. Okay. So when we go in there, pull this up here. Hold on. Come on, baby. When we go in there and we add a client, so Miss Betty Smith, and she has an MAPD plan, and I enrolled her with Aetna. We give her this MAPD Aetna tag. That's it. I don't have to do anything else because this workflow is already created. So it goes to work, and it's going to send a welcome email. Big thanks for choosing Simply Health as your Medicare partner. Your trust means the world to us. We're here to make sure you're covered, happy, worry-free. Got questions? Drop a message anytime. Cheers to your health. It's just a little whatever. Kind of cheesy, but oh well. Okay. They also get a welcome text. All right. Now, I will tell you, this generates calls to my office. They're like, who in the hell is this? It's me, dummy. I'm your agent. Oh, okay. All right. Then I send them a carrier info text. This is right after. Hello, Betty. We hope you're having a great day, and we're so glad to be able to help you along with your Medicare insurance journey. This is the member customer service for Aetna in case you need it. I'm giving her the phone number, which means I'm telling Betty, don't call me. Don't waste my time. Okay, because you guys already know you can't do anything or you can't do very much for an insured once they are enrolled. As much as you want to get involved, focus on sales. Okay. They need to learn that if they have claims questions, they want to change their doc, they need an ID card or whatever. Help your clients become a little more self-sufficient by giving them their phone number and getting them off your back. All right. Make sure you call them in order to access your plan information, make payments if they have any, find providers, and even questions on claim. Your agent, and it has my name, my phone number, my email. They get a text message with the same information. Okay. We're going to wait 2 days. And then what's going to happen, it's going to add them to another workflow. Okay. So every one of these that I have, let's go back to workflows. I have Aetna, Anthem, Blue Cross, Cigna. There's more. Devoted, United Healthcare, Humana, WellCare. Those are all the ones that I really have. And, they get that. Any questions on that? Somebody asked me a question. Let's see if my mic is working or my speaker's working. We have one question. We don't have one question. Cannot be that good. Somebody's afraid to ask me a question because I'm looking something up. Come on. I need a time filler. Come on. One time filler. Man, you guys suck. Help me out, guys. Come on. How
Good
about asking
morning,
me how?
Louis.
Thank you. That's what I wanted. Good morning.
Good morning. I jumped in late, so I'm just hearing you and I'm trying to rescue you.
Thank you. Thank you. I need help every now and then. All right. Thank you so much. All right. We're rocking. Okay. So the first thing is you stick them into that, guys. All right. Did you have to work to do that? The answer is not very much. You had to go in there under contacts and you had to add Miss Betty and you had to put their email and you had to put their phone number. I mean, really? Come on. And then it goes to work for you. All right. So now I'm done. Now it's going to go into post-enrollment, MAPD, HIP cross-sell, and year-long must-dos. All right, let's rock and roll. So now they come in here and they are going to get a HIP. All right, they're going to get a HIP. Get this moved over. All right, a HIP email and a HIP text. A HIP is hospital indemnity. And if you guys are not doing HIPs, you're leaving money on the table and you're leaving yourself open for another agent to come in and throw you under the bus. Because if I come across one of your clients and you didn't HIP them, I'm going to make them think that you're an incompetent agent. Clearly, I'm in sales. I can't believe, Miss Betty, your agent didn't offer you this. Boy, they left you totally exposed. Man, that's not a good agent, or that's not a well-trained agent. They just wanted to get the sale and get the hell out of the house, or hang up the phone. Well, let me tell you what the HIP is going to do. So let me see what plan you're on. Oh, he put you on this plan. Why? I'm just going to tear you up, Mr. or Mrs. Agent who did not cross up. And maybe you did, and they denied you. Okay, I don't know. I don't care, but I'm going to go right at it. Okay, so they put you on this plan. Why did you choose this plan? Because I think there might be something better for you. Well, I don't know why I did it. That's what the agent recommended. Okay, then I go into my deal. Okay, but they're going to get in the cross sell HIP and the email and the text. All right. Then I'm going to wait a little bit and they're going to get a video. It's a Vimeo video that they can pull up. So let's see what that looks like. It's from GTL. It's 3 minutes long. Can you all see it? Somebody give me a
Yeah.
yes.
Yes.
Okay,
Yes.
perfect. Thank you. Thank you. So let's watch this little sucker. Look how good it is.
So you just enrolled for Medicare Advantage
Okay.
health coverage. Great choice. Did you know that there's a way to protect you from the pocket expenses you incur when So you just enrolled for Medicare Advantage health coverage. Great choice. Did you know that there's a way to protect you from the out-of-pocket expenses you incur when using your Medicare Advantage coverage for hospitalizations? Help fill any gaps in coverage and strengthen your financial protection with an Advantage Plus hospital confinement indemnity insurance from Guarantee Trust Life Insurance Company. Since 2005, GTL's industry-leading Advantage Plus has been helping clients lower or completely eliminate their net out-of-pocket expenses stemming from Medicare Advantage copays and deductibles after a hospitalization event. Coverage is affordable and pays policyholders directly based on their time in the hospital, regardless of any other healthcare coverage they have. In addition, you can incur potential out-of-pocket costs for ambulance trips, outpatient surgery, skilled nursing, critical accidents, dental vision, or cancer treatments. Advantage Plus can help. Advantage Plus is offered year-round, and it's guarantee issue for ages 64.5 to 65.5. Now let's take a closer look at how it works. Meet Brian. He is 65 years old, and his Medicare Advantage coverage leaves him responsible for a daily hospitalization copay of $250 per day for his first 5 days in the hospital. The high copay is a concern for Brian. There's an easy way to help alleviate his concerns. A GTL Advantage Plus hospital indemnity insurance policy provides a restorable 6-day benefit period of $250 per day for $22.64 per month. Brian later suffered an illness that kept him in the hospital for 5 days. After the first 12 hours in the hospital, his Advantage Plus coverage kicked in. What is the out-of-pocket cost he will incur when he leaves the hospital? With his Medicare Advantage $250 per day hospital copay, his 5-day stay totaled $1,250. Luckily, Brian's Advantage Plus benefit of $250 per day for 5 days was paid directly to him and completely covered the cost. Instead of worrying about how to pay this large sum, Brian could focus on his recovery without this financial setback. GTL's Advantage Plus is flexible and versatile, with a strong set of riders to match the desired coverage for each policyholder. So what if Brian had to take an ambulance to the hospital for his illness? Adding the ambulance rider to Brian's coverage would cost him less than $5 a month, and Brian would receive $200 each time he uses an ambulance, even if he is not admitted as an inpatient. Now is a great time to think about GTL's Advantage Plus.
All right, there you go. That is it right there. Let it work for you. Now, good questions. Which HIP plan do you recommend? Even though that's a GTL video, I prefer Heartland National. That's just me, okay? Is it any better than GTL? I don't think so. I just like their platform, and I like the fact that I've got the main guy's cell number. That's it. Brandon, I can call him up. Hey, dude, I got this problem. What do I do here? Or I got this claim. The guy went in there, and he's just like, oh, just text me the bill. Like, that's it? Yeah. And it's just like, I love it. I can't get any kind of service like that from GTL. I think they're way, way bigger. But is it any better? No. Is it price a little different? I think it is, but I'm talking like chump change, like maybe $1 different in benefits, I think, last time I did it. So Heartland National is a great one. GTL is also a great one. Those are the only two that I'm aware of. Okay. Yeah, Eric, sorry, bro. California, man, talk to your DOI. Your DOI sucks, man. They don't allow HIPs over there. Okay. Sucks, the big one. All right, let's keep going. All right, so then we continue. I wait 15 days, and then I get an email. Now, here's the thing. This is the crazy thing, guys. This just generates calls to my office. what do I do here? I didn't know I had a new plan. Oh, you don't have a new plan, Betty. You're good. It just it keeps them calling me because it's got my phone number down here at the bottom. And so they call me and like, no, you're fine. We didn't enroll you in a new plan, but it gets them to interact with me. All right. But if it's somebody new that I just wrote, well, that doctor on file has their old MAPD if you flip them. All right. Sometimes they ask, have you changed insurances? They're a little more proactive. Some docs just use what they have on record. So if they use their old card, they're going to get denied. Client's going to get a bill. Client's going to be a little pissy. They're going to call you, hey, what's going on? When I'm going to pay for this? Your plan sucks. My doctor's not covered. It creates kind of now it's like, oh, no. It's okay. Doctor just filed with the wrong carrier. They didn't file with your new one. Oh, well, so anyway, I'm taking care of that here. Okay. Then I'm hitting up with dental crap. Then I'm hitting them up with, hey, life insurance. Remember, they're my clients now. Hey, I offer life insurance. Okay. Tell them about the OTC. I tell them about vision. I tell them about hearing, gym membership, order the PERS, Personal Emergency Response System, Transpo. Tell them, hey, you got a little transportation. Hey, by the way, I do accept referrals. And then by that time, it should be already September-ish. And now they're getting added to another workflow. Okay. Now they're getting added to the MAPD AEP reminder workflow. Let's go look at that one. Okay. MAPD, I think that's on my page 2 here. There. Come on, baby. Where are you? Oh, there it is. So what happens here? All right. Well, I've got a start time. I wait for October the 1st, and then I start hitting them up with letting them know. Hey, Betty, this is Luis, your Medicare agent. It's essential that you're aware of all the significant changes that happen every year in your coverage. As we approach AEP, which runs from October the 15th through December the 7th, it's important that we review your Medicare policies to make sure that you have the most suitable plan for your needs. Schedule an appointment. I have my calendar link here, and we're good to go. And then I just continue with this. I changed the wording up, but I continue with this. And then November 31st is my last one that I send out. And I'm like, hey, the clock is ticking. Give me a call. I'm wore the hell out. I'm tired. If they haven't done it by then, screw them. Maybe they'll wake up December the 6th and call me. Okay. All right. So I have that workflow. Okay. So we're rocking, guys. Okay. Is there a waiting period for hips to kick in? No, there is. If it's 64 and a half, if they're in that GI period, 64 and a half to 65 and a half. The basic benefits of hospital, ambulance, ER, outpatient, dental, all that kicks in right away. Outside of that window, there is pre-existing. Okay, so they go in, they have a pre-existing condition. I think for the first 6 months, it's not covered. Something like that. But normally, I do a lot of new to Medicare, a ton of new to Medicare. In fact, I would say I'm mostly new to Medicare. Okay, I got that magical lead source that all you guys go nuts for. Okay, you would sell your child to get, maybe you'll give away your child to get a new to Medicare list. Okay, well, I have it, and I'm not sharing it with you guys. All right, but you guys can create your own new to Medicare list. Okay, and I tell agents, how do you do that? Baby, you nailed it, Dan. Right on the money, bro. Build yourself a damn big book of ACA. I also have a big book of PNC, and I draw from that. Okay, so let's go look at my other workflow, which is my turning 64 and a half. Okay. So I enter all of our ACA clients, our PNC. I try to tell my staff, you got to put a date of birth in there. If you don't put a date of birth, you're screwing me. Okay. So when the system knows 6 months before they turn 65, it's working for you. Imagine hiring somebody just to go through your book of business to determine when they turn 65. Okay. Well, for what you're paying here, you're going to way overpay. So what it does is I get an internal notification by email and text that says, hey, Luis, wake your butt up, dude. Okay, you got a 64 and a half-year-old. Okay. Then it starts letting them know that, it sends them, let's see here. I send them a happy birthday. Okay, I know it's 6 months too early, but I wanted to reach out and let you know that 64 and a half, I have a lot of experience with Medicare and will be happy to help you navigate the system. As you approach retirement, it can be overwhelming. Let's chat. Here is my link for them to book an appointment. All right, they get the same thing on an email. I wait 90 days, which now they're going to be 64 and 3/4. Okay. Now it's time for them to, hey, go and get your Medicare. Go to the Social Security office and go get your Medicare. I don't want to waste time and enroll them. You can, but I don't have enough time. Plus, you've heard some Social Security experts, and they have said, hey, there's a exception to the exception to that exception. There's just so many variables on Medicare. They're drawing, they're not drawing. And why do you want to deal with that crap? Some of y'all don't like to stay in your lane. You want to be that person that does everything for your client. When you have a handful of clients, you can. You can't. But as you build your book, there's not enough time to do crap that doesn't make you money. So why do you want to help them get enrolled in Social Security? I had one guy here yesterday. What do I do? And he's my ACA client. I'm like, you know what? He's turning 65 in May. So I counted backwards. April, March, February. I'm like, fuck, it's February, dude. You know what? Make your appointment at the Social Security office. Well, what am I going to do there? Well, like, are you going to draw Social Security? I'm like, I don't know. I'm like, well, you know what? They'll go over that with you. Okay. But also, you need to go in there. And so we did a little Medicare 101. Because he's like, dude, I don't understand the A's and the B's and the C's and the D's. I'm like, no, just do this. I want you to go Social Security and you're going to enroll in A and B. A is going to be free. Okay, you already paid for it with your Medicare taxes. You're entitled to it. Okay, B, you're going to have to pay for it. $174 and change a month. Do I need the B? I'm like, yes, you need the B. Here's the deal. A covers the facility, the building. Okay, I mean, and so he's looking at me like, let's turn it around. I'm like, I have it upside down and I shake it. And what comes out? He's like, the people. I'm like, yeah, what people? I'm like, patients. I'm like, yeah, patients come out, but what else is going to come out? Doctors, nurses, some of the machines that are not bolted on, and medications. I'm like, yes, that's what Part B is for. A covers what you're going to keep holding. B is going to cover everything else. I mean, they don't need a whole damn explanation right now. Like, so you got to get A and B. It's like, okay, that makes sense. Like, you go get that. As soon as you get that, you call me and then we're going to finish off. Okay, I will take care of everything else. I'm like, well, what else are we going to do? I'm like, well, you know what? We may do a C, we may do a Med Sup and a D. We'll figure it out. And he's like, well, what's better? I'm like, well, I don't know. You travel. How's your retirement? And he had mentioned he had a financial planner. I'm like, oh, you're one of the rare ones. Like, what do you mean? I'm like, yeah. Said half of your people that are retiring, or I would say even 9 out of 10 of those people, all they have is Social Security, so they can't even afford to get another option. You obviously have planned for your retirement, and he's like, yeah. I said, we'll debate, we'll figure it out. You travel a little bit, like, well, maybe we'll go this way. You see a lot of docs. Well, I'm getting treatment for prostate cancer right now. I'm like, ooh, you know what? I kind of have an idea which way we're going to go. But when you get your Medicare card, we'll handle that. It's a beautiful thing. Okay. Now, and then I just continue with this stuff. Okay. Why work? Why work hard? Okay. All right. Let them turn 64 and a half. Neil, I have 2 or 3 ACAs that are gaining. Yeah, I have to reach out soon. Don't wait too long, Neil. Okay, because you know it's coming in the mail. You know they're getting phone calls, unsolicited. Oh, the other agents are breaking the rules. Really? Yes, they are. So, man, jump on your clients and then warn them about everybody else. Okay, warn them about the other agents out there. Warn them about all the carriers and the fact that they have agents that all they do is they sell that one plan. And you need to tell them, hey, I'm a broker. I work for you, not the insurance company. Okay. I get paid the same regardless of where we put you. So we're going to put you in the plan that works for you, not the plan that works for me, and not the plan that works for everybody else or your sister or your best friend or whomever. We're going to find your plan. Boom. Boom. Okay. All right. That's another workflow that's in the CRM. You don't have to build it, but you may, as you're looking at this workflow, you're like, Luis, I don't like this. I don't like the fact that this is coming out. Then you go in there, you edit it, change it. You don't like the way I'm wording this thing, change it, tweak it out, make it all yours. Okay. You definitely have to use a different trigger link. Okay. Why? Because this is my calendar. Okay. You need to make your own calendar. Okay. All right. Questions?
Luis, with
Hit
your with your CRM, with your ACA people, do you because sometimes like you'll have a spouse that's gonna be turning 65, but not the main policy holder for your ACA. Do you create a whole separate profile for them, or do you kind of add fields into your main profile on your CRM for each client? Tap a spouse, their date of birth, or email, or whatever.
Yeah, it sucks, bro. They do not have the ability to add another contact. And so you have to create another contact. And I'm like, come on, guys, how hard is that to put on there that they're married and then maybe a couple of extra fields pop up where you can put the spouse and their info? I'm like, programming wise, it cannot be that hard. And they're like, we're working on it. I'm like, all right, come on, put the damn spouse. Let us put kids in there. But as of right now, you have to make another contact. My problem is we're just adding that one contact. Kind of sucks.
You're good at telling them anyway. Like me, like every enrollment period, I get so excited when I see somebody that's going to be turning 65 soon, and I just keep drilling them. I'm like, oh, you don't have to worry about this for another, like, in 6 months, we're going to be talking about Medicare anyway. You make sure we talk in X amount of months before. So you kind of train them that they got to call you for that, because you're going to have to disenroll them. Like my state-based one anyway, I have to go in and physically disenroll them. We can't, in our state marketplace, we can't predetermine a cancellation date. We have to go in the month before and cancel. So it will cancel that month. So we don't get to say, hey, 3 months from now, I want to pre-cancel. So we're kind of in contact with those people anyway, which actually, in a way, I guess that works out in our benefit slightly. It's annoying, but kind of makes us have to talk to them before they turn 65.
That is correct. Yeah, we have to do the same thing. So we go in there, you put the date. If you have 2 people on an ACA plan, you just can't cancel the plan because you're going to lose the spouse. So you've got to go in there, report a life change, and pick that one person that is turning 65. And yeah, you got some work to do. But remember, you're going to make $616. You're going to make how much? I don't know. The HRAs are another $100 and something. Hopefully you're going to hip them and you're going to knock out another $200. I mean, you're almost going to make $1,000 deal there. Okay. And so yeah, it generates some work, but you're going to be well comped out for that amount of work. Thank you for sharing. Janine, the question, 64 and a half is automatic when we enter their birthdays. If you have that CRM and you have that workflow and you have it turned on, okay, I don't know if they turn them on for you, but you have to have it published. So go into your workflows, type in MAPD here on the search. Okay. I don't think they turn them on, but if they're not published, they're not turned on. Okay. So make sure that they're turned on. Go through each one of them, pick the trigger link. You're like, how do I get a trigger link? Well, I don't even know. When I do this, I know what to do at that one day that I know that I'm talking to them, and then I forget. So talk to them about, like, look, Luis has a trigger link. He says this is his. How do I get mine? And they're probably gonna ask you, well, what's it triggering? I'm like, well, I want them to have the ability to book an appointment. Okay. Then what you do, check this out. Okay. You are going to go to you have to make a calendar, make it your Medicare calendar. Where the hell was I? But what we're doing is let's see here if I can remember. I made a calendar called, God, I was doing this yesterday because I didn't like the link that it created for the calendar. Hold on here. Okay, here we go. So it gave me, initially, it gave me this very weird calendar. Okay. Oh, really? Oh, no wonder. I gotta fix that. Shit. Okay, I gotta fix that. I got a problem. Okay. Copy. Come on, baby. Gotta work. Perfect. Okay, you should be seeing my calendar. Okay, we haven't fixed this completely, but I've got a channel called the ACA School. It's a forward, it's a consumer-facing channel, and it's just barely starting for me. And I'm making videos on there for clients. Okay, and then so it had agentcrm.com I mean, the address was super, super long. So yesterday we changed the address to this, the acaschool.com/get one-on-one assistance. A little more personal. And then I added this, but you can put a whole bunch of wording. You can put your logo. You can fix the colors. You can make this look a little bit better. And so just tell them, hey, I need to make a calendar so people can book appointments. And then they'll show you how to do this. I have no clue how to do it. We found out like at 4 o'clock and I had to leave for tennis match, right afterwards. So know that you can create a really cool calendar for your people to book appointments on. Okay. Oh, you're missing the R. Okay, maybe that's where I screwed up. Yeah, I gotta fix that. Where am I missing the R, Karen? Was it in the URL?
Under ACA school, it says book you one-on-one appointment.
Oh crap! Hold on here. I just under book. Oh, there you go. You see, yeah, I was just like type. Like you're right. I gotta fix that, and I have no idea where to go and fix it. But you know what? If you go here, in fact, they're the ones. Me and Ivan, who were like, how do we fix this? I knew we can do it, and so I think so. We went to live Q&A. We logged into a meeting. Literally, they're just waiting. Okay. So I logged into the right meeting, and they're like, hey, how can I help you? I'm like, look, dude, I don't like this address. Can you help me fix it? Yes. What do you want? Boom. They did it. I'm like, hey, I don't like my colors. I want to put my logo. I want to fix it up. Can you help me with that? And I'm like, yeah, we'll help you with that. And then they started doing stuff, and then we had to go. But there's some stuff here that you can get them to help you with. Make your calendar look super cool and then post it out there. So you could have a Medicare calendar. You can have an ACA calendar. You can have calendars for your staff if you've got different calendars. I don't know where to go see all the different calendars. So look at all the calendars that we have, guys. Now, some of these aren't working, but yeah, I've got like way too many calendars. A lot of these are just, I don't even know why I have a Transwest medical enrollment. When to see, I don't know why I got them. Anyway, yeah, you can create as many calendars as you want. Okay. All right. What do we got, guys? Any questions on the CRM? Questions on stuff that I'm doing? Oh, I wasn't even sharing my screen. I'm sorry. Any questions? Okay. Here's what I've got for you coming up. I need a lead. I'm trying to get them on to help you guys with leads. We've got Insurance Hub, another lead company. I've got trying to get Garvin. I think he did over 200 AEP apps to come on and talk to us. I had a speaker for today, but they had something come up and couldn't join us. But that's what's coming up these next couple of Tuesdays. We've got ACA. I will tell you, those of you that are doing ACA, I got a very interesting call from an attorney who is going after these agents that are stealing policies, mainly because if they're stealing them, can't really help you with that. But if they're being stolen and they aren't aware of it, there's no documentation, and the client was harmed in the sense that maybe because of the agent of record protections, the plan is here. They move them from a silver with great benefits, and they put them in a bronze with no CSRs, higher out of pockets, where the client was harmed. So what they're doing is they're suing the agents or the organization now for the harm that it's going to be doing that person. But then they include, hey, what are you missing out on? Well, I'm missing out on a whole year's of commission. Okay, give me that number. And the bonus, give me that bonus number. And so they're throwing that in there, and they've won cases already. So I had the guy has a partner. I'm like, hey, why don't you come on my call? I can get you a ton of agents that have clients that they're stolen. So I'm going to tell you all, this is not an ACA call, but if you are AORing, make sure that your T's are crossed, your I's are dotted. You have consumer consent, you have consumer confirmation, you have the request for them to make you the agent of record. Make sure you have that, because eventually other attorneys are going to hop into this thing, and it's going to be a real thing for those thieves. If you're just doing your business right, you got nothing to worry about. But the biggest thing he was telling me, he goes, we already know. He goes, they have boiler rooms. He goes, and they're getting agents that have left the boiler room they've given them the scripts, they've given them everything, like kind of they blow in the whistleblowers, and yeah, they're really doing some bad stuff. But it is what it is. But so anyway, I'm trying to get him to come on my call. So I've got more stuff coming for you guys. So hang in there. Can you discuss the awful Medicare outpatient hospital? Marcy, I wish I knew more of it.
Okay. It's a big deal.
Okay.
I'm going to send you I'm going to send you a link I want you to look at later.
Okay. All right. Perfect.
About it. Yeah.
Okay.
Okay.
Is this more of like an MAPD issue or a MedSup issue, or?
Well, I think it's a advantage issue. That was one of my questions. I don't believe it's a MedSup, but I do believe it is an advantage, an MA problem.
Okay.
It's a new thing going on in the industry. And
Wow.
I personally experienced it with my mother this past week.
Wow. Well, tell us what's going on. Inform us.
So Medicare is starting this new rule. They don't want to pay for I hope I'm explaining this right. They don't want to pay for everything. So instead of letting somebody be admitted when they go into an emergency hospital room or whatever, they want to put you in this observation for 48 hours. And they were literally treating my mother like drawing blood in the emergency room. All the hospitals in the Michigan area that I'm in are overflowed because of this problem, that they don't want to admit people into the hospital because Medicare doesn't, the clock starts ticking if they get admitted, that they have to pay for it. So they don't want to, they require it like an evaluation period. And if they think you're going to be there less than 2 days, they're going to leave you in an observation area and treat you there instead of admitting you in the hospital, because the hospital will have to pay for, I'm really not explaining this well, but they won't pay for it if they get admitted and they could have been treated quicker or something. I have to send it to you. It's really, I need your help with this because it's exploding. I guess it has to do with now that there's so many people that are in Medicare and ACA, that the government's, strained with paying for all of this. So they're trying to get out of paying for some of the fees and different things, avoiding it, putting people in an observation period.
Okay, send it to me. What I can try to do is maybe get a carrier rep to come, because
Yes.
honestly, I have no knowledge on it.
Okay.
I mean, like in your case, you personally experienced it, but I don't experience, I have yet to experience it with any of my clients, and I really try to take myself out of it because I just
Okay.
don't have the time, nor do I have the
Sounds more
ability.
like sounds more like the hospitals are playing games because they're reimbursed. It almost seems the other way around. It's not the government, but maybe the hospitals are finding ways to say, we're going to keep you in observation because the clock starts ticking once you're admitted, and then they want to rush you out. So we might get higher reimbursement while we create all these fees while you're in observation versus our reimbursement when we put you in the actual hospital. Almost seems like maybe the hospitals are the ones trying to play games and work the system on how they're getting paid back from the
Actually,
care.
that makes a lot of sense. Yeah.
Well, Louise, a little background on that.
Go ahead.
That actually went into effect a couple of years ago. And the reason it went into effect is because Medicare pays hospitals a flat fee for, like, say, if you have a heart attack, they know by the number of cases that they've done with that you're going to be in the hospital for X amount of days. So they give them a flat fee. Hospitals were saying, okay, let's say Luis is supposed to be in here for 7 days, but we can get him out in 6 days. And they get you out in 6 days. And then 30 days later, Luis goes back to the hospital for that same condition. Medicare does not pay a separate benefit to the hospital or fees to the hospital if the client is going back there for the same condition. So in order to get paid, what they were doing is they would put a person into observation. And then if they got him out early and the client came back, they were able to say, well, we didn't admit him the first time. He was just here for observation. So they still get paid.
Wow, it's all about
Excellent
money.
way of explaining it. Yes.
Yeah, it's also so yeah. Yeah, well, send it to me. I will try to get us maybe a carrier person to come in and maybe talk about it. But yeah, it
It
seems
could
like
be an
it's a
HMO PPO thing too.
yeah,
You know,
it's all about the money, man. Usually that's what I've seen. Things happen and they're trying to maximize their pay.
She does have a PPO.
Oh, on top of that. Wow.
Hmm.
Okay. Well, yeah, just send it to me and I'll try to see where we can put something from the carrier point of view, and we'll go with that.
So
Okay, thank you.
what happens is they're treated as an outpatient. Is that what you're saying?
Yes.
Rather than an inpatient because it's observation.
Right. No matter how sick they are.
Right. They're treated as an outpatient and then they bill Medicare as an outpatient service. Then if they come back and they need to be an inpatient, Medicare is not penalizing the hospital for rushing the patient out.
And it probably ends up causing more out of cost sharing on the patient side at the end of the day, I bet too.
Yes.
Yep.
Wow. You know, and maybe they can make that up. I mean, and this may be a little good cross-selling deal. You know, outpatient, you know, you can add outpatient to your HIP plans. Hey, hospitals are doing this, Mr. Client. So you know, you're going to incur an additional charge when when you're in observation or outpatient. And how about we take care of that with a HIP? Now you get your premium up a little bit higher. Never know. Never know, guys. Okay, thank you for sharing, Martha. Yes, and just send it to me.
One
I'll
more
definitely
thing.
Go ahead.
Since I'm thinking of that I don't have Advantage Plus or Heartland National. How do I I don't
Email
even know if
me.
here in Michigan I got to find out, but yeah.
Yeah, I don't know either. But you know what? Just send me an email. Let's start off with Heartland National. I'll send
Okay.
you over a contract for that.
Mhm.
And then if you don't have GTL, we'll get you set up with GTL.
Thank you.
Okay, shoot me up. And then guys, I posted the link there if y'all want to try the CRM. You know, mine's the one that I use is not, you know, they're all the same. Okay. I will tell you, all the big boys in the Medicare industry, they're all using a version of Go High Level. Okay. And you know, the version I use is Agent CRM. There's all kinds of versions. The only thing I will tell you, and I have kind of spied, I'll go in there and use their link. I'm sure they've done the same for me, but you know, I use their link or I'll get one of my people. Hey, let's go look and see what they've got. They don't have crap for workloads. They got the same tools we got. They have all the stuff on the left-hand side, but they don't have the support that Agent CRM has, the live Q&As, the support team there. And then on top of that, they don't have the workflows. Some of these, you know, I don't, they're like pet projects. They're money makers. Okay. You know, for them, they're just little side projects and they do it. They're like, hey, get it. But those workflows that I've created are workflows that I use. You know, they're not dreamt up and oh, hopefully it works for you. I don't have time to make crap up and see if it's going to work. So we do stuff only for one purpose: take care of the client. And number two, by taking care of the client, I'm going to make more money. That's it. Attorney 65, that maintaining or that MAPD throughout the year, all that is all about keeping that client with me. Okay. Because I make money on my renewals. 75% of my income is from renewals. 25% is from new business. So I need to grow my renewal income, and that's why all this stuff that we create is all about maintaining it. So anyway, give it a shot, guys. Hope it works. Tomorrow we have ACA. I think we're in class 3 or 4. I can't remember, but we'll have ACA, and then on Thursday we will have Medicare. I think we're in class 3 of Medicare. And I've revamped the course, guys. So if some of y'all have been in there, great. I've completely redone it. Okay. So we've got just new updates, and I got a new girl here. She came from a call center. She's helping me out a lot. So we've really done some new changes on this thing. So come join us on Thursday if you want to get some new stuff. All right, guys, I'm out of here. Thank you. And we'll see y'all tomorrow. Bye-bye.
Thank you.
You're welcome.